Hello everyone, welcome to my YouTube channel momofkiaan. So today we have Dr. Jagruthi with us to explain about her pregnancy and delivery journey as well as maternity leave and Mutterschaft girl. She lives in Berlin, so that would be great to have her inputs from Berlin as well. So for the my first question is, how's your pregnancy journey and how did you manage?
Okay, so my pregnancy journey was quite good. I was quite healthy and active during my pregnancy.
Okay.
But I had one complication that I was diagnosed with gestational diabetes. So,
Okay.
fifth months onwards, I had to be on a very strict diet. Otherwise, the doctors were advising me to go on insulin, and I didn't want to go on insulin. But
Mhm.
with the diet and physical activity, I could control it, and I didn't go on insulin. And other than that, everything was very smooth because all the doctor I had was very nice, and everything was within reach because I was in Berlin. So even for gestational diabetes, they have a specific hospital. So all the women with gestational diabetes, there is a hospital called St. Joseph Hospital, St. Joseph Krankenhaus. So you are referred and you are encouraged to deliver there because they have specialist doctors who deal with gestational diabetes. And so after my fifth month, I had to visit my gynecologist as well as the hospital, both.
Okay.
So my visits were double the normal visits, like you will
Mhm.
visit once in a month. So I had to visit once in a month my own gynecologist, and then other time I had to visit the hospital as well. But it was not a problem at all because everything was within reach, and I could travel on my own. I didn't had any problems that I so it was all good.
Okay. So did they advise you any like minor exercises to control gestational diabetes? So how did you manage it?
They didn't advise me in particular something, but
Mhm.
I had already started taking prenatal yoga and Pilates classes. So where I live, there was a class available nearby my place. So I had already enrolled for that. And when I was diagnosed that okay, I have a gestational diabetes, then I was more encouraged to do that. And what helped me a lot was that I was walking after almost every meal after
Mhm.
20 minutes, like for 20 minutes or 30 minutes. So all this together helped me quite a lot. And yeah.
Okay, that's great actually. I think many women complaining about this gestational diabetes in some WhatsApp group. So I think this will be helpful for many women, I think so. So,
Listen to your body,
um,
even when you go for an exercise, don't strain yourself or don't stress yourself to do something that your body doesn't allow. So do as much as you can, start slowly. If you are not, I was active even before pregnancy, so it was maybe a little bit easier for me to stretch. And but some people, if they are not active before pregnancy, I will suggest them to go little by little, step by step, not like going the first day and doing all the stretches and all. So
mm,
you can just talk to your teacher if you're taking an online class, or if you're taking in-person classes, just tell them your situation, like you were active at all or you are not active at all. So that would be that one should consider.
yeah, it would be a great tip actually. So how did you find your gynecologist in Berlin? So can we survive without German in Berlin? I hear the Berlin is more international.
Yes, of course, in Berlin you can survive without German. uh, Especially in my case, before my pregnancy, I had two gynecologists, and I changed because I was not happy with them. And then this third one, uh, I changed, and I was very happy with her, and she was very understanding, and
Mm-hmm.
she was ready to listen sometimes. Like some here in Germany, people have a feeling that doctors don't interact much.
Yeah.
So that gives you a feeling that, okay, the doctor is not listening to you and something like that. So in that case, this doctor was like, okay, interactive and giving you some, for example, here doctors never give you an advice what to eat, what not to eat.
Mm.
So in India, if you go to a doctor, they will advise you, okay, you are pregnant, they will give you, okay, you do do's and don'ts. Here, doctors don't give any do's and don'ts. So you
Yeah.
have to somehow follow your tradition in your family, listen to your family how they have been following, and mix it with something what happens here.
Yeah. So do we need to inform like previous gynecologist before changing to new gynecologist?
No, I didn't do that.
Okay, so we can like switch it like
Yes,
right
yes,
away.
you can
Okay.
search. In my case, yes. And sometimes even if you don't find a gynecologist, just contact your health insurance provider, for example, TK or AOK,
Mm.
and they might also give you a list in the region where you are living, and okay, you can try to choose.
So according to your experience, do you suggest like, do we need to deliver in Germany or in India, according to your experience?
Okay. So to compare, I should have experience in both countries, ideally, and I do not have an experience in India.
Okay.
So I think I won't be the correct person to say if you should choose, because in India I don't know how the system goes, but for sure there is a lot of support, family support, and here a lot of things you have to do on your own.
Mm. Yeah.
So women who have given birth here, they can confirm this. Okay, here you have to do a lot more than you will do in India. But few things that I have heard, not my experience, that here the doctors encourage you a lot for normal delivery, and in India it's not the case. But I don't know if that's true at all.
Mm.
So
Okay.
this is the only difference I find.
Mm.
But the other difference is, for example, if someone is living here and is other than the health and the support aspects, if you talk about the bureaucracy, for example, if you give birth here in Germany and you are living here, then a lot of bureaucracy is cut down. For example, you will not have to apply for uh, mm, a visa and all those things for your child in India. And if you do not travel within 6 months, then your current visa will also expire. So
Yeah.
to it depends what would you prefer.
Mm. Yeah.
So there are
That's
many
true.
aspects in my
Yeah.
opinion.
Can I ask you, maybe it's personal, is your delivery is normal or C-section?
It was a normal delivery.
Did you went any courses before delivery?
No, actually, no. There was a
Okay.
birth preparation course in the weekend. For
Mm-hmm.
example, in I think it's available in whole Germany, and
Okay.
it's included in your health insurance.
Mm-hmm.
So in that, because we are English speaking people and we do not understand German, so the options are very less. Like there are few Hebbemas who does this. You get a lot of information, even if it's like few hours of that course,
Mm.
but they give
Okay.
you information like when should you go to the hospital, how should you measure, like when you get your labor pain. So how intense it is when you should go to the hospital. Otherwise, what happens that you go to the hospital and then in Germany they send you back.
Okay.
And for us, it's horrifying. Like, okay, we are in labor
Mhm.
pain and they are asking us to go back. Because for me also, it was very like, even when I thought, okay, if I go to the hospital and they say go back from hospital and to house. So
Like, how do you know these are my exact labor pains? No, I'm ready for delivery. So, did you panic? Like, how is your emotion at that time?
Uh, pa- panic. Actually, my mother was here. Luckily,
Okay. Okay.
she could come 1 month before the delivery. So
Mm-hmm.
she was around. So it was a great help. And yes, I actually had started these false contractions 1 week ago. like I used to have sometimes. So it was kind of an indication, okay, the time is coming. And then the day we went to the hospital was that I had a little bit of bleeding, so we got scared, and we had a little bit of contraction, but it was like here and there, not regular. So we went to the hospital, and then the doctor checked us in the emergency, and then the doctor said like, okay, you come later. Now, as I told you, my nightmare was real. So the doctor said, okay, you are in labor, but it's still some time that we will take you in the labor room. So we came back so we went to the hospital like 3 in the night, and then we came back home around like 6 o'clock or something, and then again 7 or 7:30, I don't remember the exact timing, we went back because my labor was then more active. And then this time they admitted me around 8 or 8:30, I don't remember. And then they for first half an hour or something, I was in the normal maternity ward. And then they took me to the labor ward, I think around 10. Yeah, around 10. My husband helped me from the so around 10 I went to the labor ward, like proper where you give birth. Yeah. And then it was a long labor because it was like almost, I was in the labor room for 10 in the morning, and then I gave birth. She was born at 12, like 3 minutes past 12. So it was almost 14 hours.
Okay.
Yeah.
Okay. So have you took epidural?
Yeah, I took in the after quite some time I took.
Okay. I think for normal labor pains, how did they manage giving labor epidural?
Okay, so for that, I would say the birth preparation classes I took was very helpful because the Hebbame was very good. That Hebbame who gave us this birth preparation course, and she covered a lot of topics, and she gave us an idea like what are our options when we are going to the hospital. Like there are, as you might know, there are several options. You can give birth in water, and then there are some other options also. So she also told me that, okay, to take epidural, don't take it the first not in the first 2 hours or something, because the first baby comes little late, it's not, if it's second baby, it will be, maybe I do not have any experience, but what I have heard, the delivery for the second baby is easier, but for the first baby is difficult. So she kind of gave us an idea like, okay, um, when your dilation is this much, then you should go for epidural, because if it's less than this or more than that, if it's less than a particular size, then what happens, maybe you will not dilate anymore, maybe. I'm not sure, it's just what I got from her, because then your pain will be a little bit less, so you will be more tired, but maybe you will not dilate more. And if it is open more, then the doctors will say, okay, now it's going to happen. So there is a certain time period when you have to take it. So I think it's better to ask your Hebbame or someone to get this idea.
Okay. How long before did you register for the Hebbame in Berlin?
I started looking for a Hebbame when I came to know I'm pregnant, because in Berlin everything is very scarce. Like you have to start looking for everything in advance.
Okay.
But my Hebbame was not. I visited my Hebbame only 2 times before birth. And after birth, my daughter had some complications, so we had to stay in the hospital. She was in neonatal for like 6-7 days. So we came back home after 10 days. So and then she used to come only to take weight of my baby. So it was okay, but I'm not sure if other Hebbames are more useful, or what can you do with them. So this is one information.
Okay.
But for sure, she was helpful to check if you have got, like I had got some stitches due to some tear, and then she used to check baby's weight. So
Okay.
that was nice.
Okay. She used to speak English?
Yeah, she was. She
Okay,
used to
that's
speak
nice.
English.
Her delivery, like in the hospital, how long did you admit?
I had a normal delivery. So for normal delivery, they discharge you usually after 2 days. But when we were about to discharge, they came to know that my daughter had some infection. So they moved her to near an ICU,
Okay.
and we had to stay more for like 7 days.
Oh, okay. So, did you stay along with the Ananya in the hospital?
So for the first 2 days, they gave me an apartment in the same building,
Okay.
because they did not had a bed with the baby, because
Mm-hmm.
she was in the first they gave me a room, kind of, it was kind of in a small apartment in the
Okay.
hospital, and I stayed there with my husband. And after 3 or 4 days, then they moved us to normal children ward, where I can
Okay.
be with my daughter all the time.
Mm-hmm.
And we stayed there
Oh, okay, that's nice.
the rest of the 2 3 days.
Yeah. Recently, I have interviewed Radhika. She said that we need to search the hospital which had NICU, even for for the kids specialist in the hospital, so that they don't separate. They don't discharge the
Yeah,
mother.
yeah, actually, that is also one thing, that not all the hospitals have an ICU. So in my case,
Mm,
because it was a specific hospital, so we could stay in the same hospital. But even if
mm,
you stay in the same hospital until they are in the isolation, they you cannot be with them all the time. You can just
okay.
go feed them, come back, and then after a while they put you together.
Most of my breastfeeding tips were came from the Jagruthi. She helped me a lot. So now I want to ask about her breastfeeding journey. So could you explain?
My breastfeeding journey was very emotional, and very exhausting, and
Mm,
not very nice in my words.
okay.
That's why whenever I meet a would-be mother, and if the person is interested in breastfeeding, I just I try to tell them what I should have done, because I didn't have the knowledge.
Mm,
Because in my case, what happened, because she was in an ICU, and then for 10 days we were in the hospital. I was sleep deprived, and uh, I didn't have a prior knowledge how to do this. And usually what happens, here they say, okay, you do not have enough milk, the milk production
mm,
is slow, then they ask you to feed the baby with formula, and that's where I think the chaos starts.
yeah.
So, and then you try to pump, then you feed the baby, and then in the initial time they have this, what do you call, Kavita, with the injection and all, with the pipe in the
Yeah.
injection.
Yeah.
Yeah,
With injection, that's it. Syringe.
yeah, so yeah, with the syringe, and and it's very tiring. I think Kavita
Yeah.
can affirm that. And in my case, I had a very good experience in the labor room, but unfortunately I didn't have very good aftercare, because the
Mm,
nurse, I gave birth and I went to the normal maternity ward, and then nobody, like, I knew that I should feed my baby, because I read and studied, okay, I did my research, like, okay, you should feed baby as soon as possible. But because that time I was not able to think so much, and the nurse didn't put my baby on my breast, so she wasn't
mm,
breastfed for like, for many hours, and then she was
mm,
sleeping and sleeping and sleeping. She was not able to feed, and then the nurses were not very helpful. I can say
oh,
that.
okay.
Yeah, so that was also a reason that our breastfeeding journey was difficult, because it could not establish in the initial hours, so
Hmm.
it was difficult later.
Yeah, that's true.
So in my opinion, read as much as one can, about breastfeeding, and as much information you can gather, and maybe inform your partner, because most of the time even my mother was here, but she was not in the delivery room, or
Okay.
in just after that she was at home here. So my partner was there, and so you can inform your partners like, okay, when I am not in my senses, you have to do
Mm,
this. So maybe
okay.
prepare them also, so then
Mm,
they can help you, because they have the information. Because if they do not have the information, then it might be a little bit difficult.
difficult. Yeah, that's true. Even
It's
I
just my
can.
experience and my opinion.
Yeah. If you have any doubts about more like about maternity leave and like in pregnancy and delivery in Berlin, you can comment in the comment section. So Jagriti or I may reply those questions.
Yeah, sure. Happy to help.
Mm, that's wonderful, Jagriti. Uh, Thanks for your precious time. No,
Thank you for having me.
my pleasure. So it will be helpful for a lot of women and who is also working, they maybe they don't have any idea about this Elton Girl and all.
You are doing great job, because I think it
Thanks.
will definitely help people who are looking for some answers like these.
Thank, thank you
Yeah,
so
like,
much.
share, and subscribe.